Good evening, and welcome to this program in recognition of Black History Month. Many thanks to you for joining this event. Our program is sponsored by the Black Long-Term Care Executives in collaboration with the Healthcare Executives Club. These two organizations work together and sponsor valuable educational programs throughout the year. My name is FitzPatrick, and I'm the Vice President of the Black Long-Term Care Executives. Marcia Thomas-Brown is our Treasurer of the Black Long-Term Care Executives, and we are co-chairing this event. Many thanks to Marcia Stiles, President of the Black Long-Term Care Executives, and Dennis Conway, President of the Health Care Executives Club. Marcia Thomas-Brown and I have to give a special thank you to our technical support team made up of Jack Southerland, Bobby FitzPatrick, and Nicholas Guam. Their support has been invaluable. We could not have done this without them. On behalf of the organizers, we thank our presenters for taking the time out of their busy schedules to share their experiences with us. Tonight, the theme for this evening is She Believed She Could, So She Did. Black women in the workplace. You will hear from 4 fabulous Black women who are trailblazers, and they will provide us with some insight into their respective fields. My co-chair, Marcia Thomas-Brown, will introduce our speakers. Questions for speakers should be entered in the Q&A section. And after all the presenters have given their presentations, we will go to your questions and have each individual panelist give a response as required. So now, it's my pleasure to turn over the stage to my co-host and co-chair, Marcia Thomas-Brown.
Thank you very much, Verna, and thank all for participating. We're really excited about this presentation. Obviously, Black History Month means everything to all of us, and we're looking forward, hopefully, to you enjoying the presentation, but also for you to get information about, the Black communities, the different areas that involve in being able to execute our daily lives and those that are contributing to make our lives better. As we were preparing for this presentation, I found this quote from Ms. Shirley Chisholm, and I think it really pulled together the way how we feel about what we're doing here today. And it said that you don't make progress by standing on the sidelines, whimpering and complaining. You make progress by implementing ideas. And I feel that the 4 young women that are with us today actually took that quote and put it into action. As Verna and I thought about what we could do to celebrate Black History Month, much came to our minds, including throwing a dinner party with lots of wine and lots of music. Those of you that know me love that. I would go there. But then we came across the statement that she read. She believed she could, so she did. 4 young women actually took this seriously. Our 4 presenters today took their beliefs, passion, and converted them into action. So this evening, our first presenter, we will start with Dr. Elena FitzPatrick Sifford. Dr. Sifford is Associate Professor of Art History and Director of Latin American and Caribbean Studies at Muhlenberg College. And as Verna mentioned, she's her daughter. When we think of history and when we look at her background, we think about learning through books and reading. one of the uniqueness I think about Dr. Sifford is that she also is able to do that through art, history through art. Tonight, however, we will be hearing from her as relates to diversity, equity, and inclusion in academia. So we can get started with Dr. Sifford. You're on, Dr. Sifford.
Thank you. Thank you for that introduction. So my talk is called Diversity, Equity, and Inclusion in Academia, a View from a Professor of Art History. So I wanted to start off with some inspiring quotations, beginning with one here, which is, "Education is our passport to the future, for tomorrow belongs to the people who prepare for it today." And this is from the great Malcolm X, who reminds us of the importance of education and education as a tool for a better tomorrow, a better future. And then I bring in another quotation by W.E.B. Du Bois, who said, "The function of the university is not simply to teach breadwinning or to furnish teachers for the public schools or to be a center of polite society. It is, above all, to be the organ of the fine adjustment between real life and the growing knowledge of life, an adjustment which forms the secret of civilization." And this is one of the things, W.E. Du Bois is one of the scholars who very much inspires my work in terms of thinking about universities and higher education as something that goes beyond a need for an accreditation or a need for a degree, but something that education gives us, which is this larger knowledge and these tools that we can use in our greater lives and to better our communities. So I wanted to talk today a little bit about college completion in minority and particularly Black communities, as well as how the diversity of academia relates to that issue. So I'm starting off with talking about a few important demographics. So slightly more than half of Black and Latino students earned a degree after 6 years, compared with nearly 70% of white students. So you can see that 70% of white students complete their undergraduate degrees in 6 years or less versus only about 51% of Black and Latino students. But interestingly, research has found that minority students who have educators of the same race or ethnicity are more likely to look to those teachers as role models and to report greater effort in school and higher education goals. A study looking at community college classrooms found that performance gaps of minority students can close by 20 to 50% if faculty more closely resembled their students. So I think that this is something really important for me as an educator in higher education, is knowing that simply by being there, by being a person of color, by being a Black woman who is at the podium, who is, educating young undergraduate students, they have that much more of a chance of graduating just based on that fact, that having faculty members from their ethnic and racial groups makes them feel more at home and gives them a greater sense of confidence, and it literally makes them more likely to graduate on time. So in terms of faculty demographics, the demographics aren't great. So for example, in the fall of 2017, about 3/4 of post-secondary faculty members in the US were white. So about 76% of college professors were white. Meanwhile, about 55% of undergraduate students. In the fall of 2017, only 5% of faculty members were Hispanic compared to 20% of undergraduates. Black faculty were also underrepresented compared with the Black undergraduate population, right? So 6% of faculty were Black versus 14% of the undergraduate population. Right. So what this shows us is that white faculty are overrepresented in comparison to undergraduates, right? So only 55% of undergraduates are white, and yet 76% of college faculty members are white, right? And it's great that when we see that 20% of undergraduates are Hispanic, yet only 5% of faculty members are Hispanic, and 14% of undergraduates are Black versus only 6% of the faculty. So this is essentially what I'm trying to pull out with showing you these demographics, which is that when you compare these, you can see that white faculty are way overrepresented. And even when you look at the population of both Black and Hispanic people in the United States, you can see that Black people are underrepresented overall in higher education, right? So the Black population in the US is 13.5%, right? While our undergraduate numbers are about commensurate with that, right? We've got about 14% of the undergraduate population and 13.5% of the overall population, with having only 6% of faculty members being Black. Again, we see that real underrepresentation. That's kind of some demographics about undergraduates as it compares to demographics about faculty. Now I want to talk a little bit about graduate students and the question of pipelines. So we know that if we have more faculty members of color, students of color are going to do better, right? They're going to graduate faster. They are going to, pursue graduate degrees at a higher rate. And so then the question is we need to understand how we can improve this overall if we have this issue where we need more Black faculty in order to graduate more Black students, but we don't have enough of either of those numbers. So of doctoral students in the United States, approximately 11% are Black. So are we talking about a pipeline issue here? In order to graduate more Black undergraduates, we need more Black faculty. In order to produce more Black faculty, we need more Black students coming out of undergraduate studies and pursuing doctorates and wanting to go into the professoriate. And so it's almost like a chicken or the egg type of question. We want more students into the pipeline, but in order to graduate more Black students, we need more Black faculty. And so how can we improve that when it's almost like a cyclical issue, right? So I'm going to offer some suggestions of ways that I have, sought out to be part of the change as a faculty member, as a Black faculty member. So I'm referring to this as widening the pipeline, right? So how do we get more Black students to become interested in, pursuing graduate degrees, right? As I showed you before, only 11% of doctoral students are Black. And so we need more people to go into these degrees, right? So that more will enter into the professoriate. So here are some suggestions. The first suggestion that I'm offering is informal mentorship versus academic advising. And this is something that I see often happening both in my current institution and in past institutions that I've been part of, whether as a graduate student, an undergraduate student, and my previous job as an assistant professor before my current associate professor position, is that Black faculty, and I should say a lot of faculty members of color overall, tend to take on a lot of mentorship. And so what does that look like? So mentorship goes beyond academic advising, right? So we might have students who we have to advise in terms of how to get through the major, what courses they need to take, and so on. And that's something that pretty much all faculty members have to do. But informal mentorship goes beyond that. So it has to do with helping students to strategize about their future plans, whether that be internships, jobs, applying for graduate school, and all the many steps that goes along with that. And that will include not only writing letters of recommendation, but also doing things like helping them to edit their materials so that they can write the best possible cover letters and essays and so on for all of these various applications. It's helping them to seek out more opportunities by doing some of the legwork and some of the networking as well. And it might mean things like, giving out our cell phone number and letting students text us when things come up, and essentially offering them a greater insight into what it means to be a college professor, which relates to my next point, which is demystifying the professoriate. So this means letting students know that what it is that we do, right? And so I'm always often encouraging students to come to my office hours. A lot of students, particularly first generation college students, many of whom are students of color, they don't know what office hours means. And many of the white students are more familiar with this. And so they're more likely to come into your office and ask questions and try to get to know you. And so letting students know this is what office hours are for. It's for you to get to know me. It's for me to get to know you. What makes you tick? What are your future dreams and plans? Beyond just asking a question about the course, right? And so once students begin to understand that your office is a safe space, then there are so many more opportunities that can come from there in terms of getting to know them and really being able to help them in ways that go, again, beyond simply being their academic advisor. The next suggestion that I have is using both formal and informal networking. Networking is huge and really can help students, particularly, I think, when students are still undergraduates and still trying to seek out knowledge of various different fields and what their interests are and trying to kind of hone in on what those interests are. So helping them with networking by introducing folks. For example, I teach undergraduates, but I have a colleague who I work with who runs a graduate program, who is looking for highly motivated students of color, and making sure that we can make those connections and bridge those gaps that students might not have access to from their own personal lives, and to put them in touch with those people who do have resources for them. Next is democratizing the acquisition of knowledge. This is really huge, and it's something that I take very seriously as an art historian, as a college professor, is that part of my job is to create knowledge, right? To create publications. And most of the publications that we produce as people in academia tends to be only read by other people in academia. And for me, and that's very much kind of valued in academia, is what kinds of publications are your articles and your research coming out in. But unfortunately, most of those publications aren't being read by regular people. And what that means is that they're not reaching the minds of young people or people who might not normally be exposed to the field that you're in. And so I like to really emphasize more democratic modes of sharing what I know and what I've learned and what my research is about. So currently, for example, I'm a content fellow at Smart History, which is the most trafficked art history website on the web. And what that means is that the website gets millions of hits from all around the world. Anybody who has an internet connection or a smartphone can very easily find this website. If they type in any work of art, it's probably going to be one of the first sites that pops up for them. And it allows people access to the articles that I'm writing and the works of art that I'm writing about in ways that are much more accessible. They're much more, they have a lot less jargon in them, and they're meant to be written in a much more conversational way that will grab people's interest. As an art historian, art history can oftentimes feel like a very elitist discipline, and one that a lot of people don't feel comfortable with or don't have a lot of background in. And this is just one small way to make it more accessible for people to feel like they can understand the history of art through this website that really is meant to speak to them. The last thing the last suggestion that I have is encouraging young people to pursue internships and experiential learning. One of the things that I do in the beginning of my courses is I ask students why they're there. And I find it really interesting whether students are there to fulfill requirements. But many of them in my field, again, as an art historian, many of them will say things like, I went to Paris this summer with my family, and I went to the Louvre, and, I went to this museum, or I went to this, city, and I was interested in learning more. So many of those students are from very privileged backgrounds. Many of those students are white students, and they become interested in the field because they have had some exposure to this that other students may not have had. And once they have those experiences, they are kind of setting themselves apart for their future pursuits, because they can speak to hands-on experience that they've had and direct exposures that they've had. And that really sets them apart in terms of applications for graduate school in particular, and for fellowships and internships and all of that sort of thing, which is what people, and I've been on some of these, hiring committees and so on, people really look for this type of experiential learning. And so I really try to encourage my students to find ways to have experiential learning, whether that's in informal ways of going to their local museums or local libraries and so on, or even better yet, pursuing things like internships. Internships can be difficult because oftentimes they're unpaid, but there are paid internships out there, and they make a huge difference in terms of allowing students to really stand out with their experience, their knowledge, when they're then applying for future opportunities. Okay, so I'm going to move on to talking about just the importance of higher education now. So clearly I have a vested interest in this because, I'm a Black woman and I'm an art historian. And so these are things that I love, and these are things that I want to share with other members of the community. But we can even look at it from an economic standpoint at just how important it is. And I think many of us, all of us, know this, but to see these numbers really how they play out, I think hammers the point home even more of how important it is for us generally, and then specifically for people in academia, to help students make their way through the degree and to go forth in their lives armed with a formal education. So the median earnings of bachelor's degree recipients with no advanced degree beyond the BA working full-time were around $24,900 higher than those of high school graduates. So in 2018, the earnings by degree levels, you can see them here. I don't have to read through all of them, but you can see from high school all the way through doctoral degrees and professional degrees, you can see the median earnings, and you really get a sense of just how stark those differences are based on what degree you have, right? And interestingly, I have a doctoral degree. I don't have a professional degree. A professional degree would be something like a law degree or an MBA. And you can see that those are even more higher earning, I guess no surprise there, than doctoral degrees, who tend to be in academia, which it's a decent salary, but it's certainly not on the level of other professional degrees. That's not the reason why I'm in the field. I'm in the field because not only does it pay, decently, but it is such a rewarding career for me, and it really allows me to pursue my interests. But here you can see kind of some of these numbers and the breakdown. So the other interesting thing is that with higher education is that beyond economic benefits, there are many other benefits. So relative to those with less than a college degree, individuals who had earned a BA or higher were more likely to receive employer-provided retirement plans, more likely to receive employer-provided health insurance, and less likely to live in a household receiving public benefits. And then beyond that, college graduates are also substantially more likely than those with less education to exercise vigorously at least once a week. They're 3 times less likely to smoke. Children of parents with higher levels of education are more likely than other children to engage in a variety of educational activities with their family members. College graduates are more than twice as likely than those with a high school diploma to volunteer in their communities. And in the 2016 presidential election, sorry. Okay. Well, my apologies. I just went a little too far here. Okay. So you can see some of these statistics here with that, you're also more likely to vote, right, if you have a college degree. So we can see that there are all of these benefits with higher education, and these are things that I take very seriously as part of my career in terms of mentoring the next generation, and particularly students who are first generation students who don't have as much experience with higher education or don't have as much exposure to higher education. I think that many of the suggestions that I gave earlier in this talk really speak to how to be the change and how to help young people to be able to complete these degrees, and not only to complete their undergraduate degrees, but to then go on to graduate school, and ideally to go on, from my perspective, those who are interested in going to academia, it's almost a self-fulfilling thing, because as I mentioned before, the more faculty of color we have, the more students of color we will have who are successful. So I've spent a lot of time now talking about academia, which is wonderful, but I also wanted to just close with the wise words of Maya Angelou, who said, "My mother said I must always be intolerant of ignorance, but understanding of illiteracy, that some people unable to go to school were more educated and more intelligent than college professors." Thank you.
Thank you. Let me get back on here. Thank you, Dr. Sifford. I appreciate your presentation. Actually, a lot of information. Many of us, when you look at our daily lives, and there are people doing many things in many industries, and sometimes you walk down the street and you go, wonder who does this or wonder who does that. And education is one of those areas that in the Black community, we are very much limiting ourselves. And sadly enough, is one of the foundations that determine our future. And so our hope is that, we take this information and actually use it to be able to motivate those students, parents, family members, industry, to be able to support that and understand why it's important to continue to encourage our children to be educated and actually focus on becoming a college professor. Next, we will have our presentation. In the presentation, we will have Dr. Mauvareen Beverley. Dr. Beverley is the president of Mauvareen Beverley, MD, PPLC, Patient Engagement and Cultural Competence Specialist. She's also a member of the Healthcare Executive Club, and we lovingly refer to her as Dr. B. These days, we hear much about health disparities, health equity, social determinants of health, and cultural competency. But what we don't really understand is how these terms affect the average Black patient receiving health care in America. Dr. Beverley would provide some insight into what that actually means in our daily lives. And so, Dr. Beverley, you're on. And before you get started, just let me remind everyone to please put your questions and comments in the Q&A box as we move forward. So you're on, Dr. Beverley.
Thank you. Good evening, everyone. It is such an honor for me to be a part of this amazing panel. And just want to say thanks to Healthcare Executives Club and the Black Long-Term Care Executives, and also to Werner and Marcia for the great work that you have done in recognizing and creating an environment to discuss Black History Month. And I think the concept, she believed she should, so she did, Black women in the workforce, is just very timely. Okay, so my topic is going to be on innovative programs that I've developed in the past, when I was at New York City Health and Hospital, I developed the first care management program. And I'm going to focus a bit on what we call the bridge team and the impact it has on patients with sickle cell disease and patients with congestive heart failure. Okay, next slide, please. So the bridge team. The bridge team is part of the care management program, and it's really to look at the complex cases. Is a complex case bridge team initiative was implemented. As I said, this is at Queens Hospital, is a part of New York City Health and Hospital, and it's a part of Queens Health Network, inclusive of Elmhurst and Queens Hospital. And the focus was on the needs with patients with complex diagnosis by improving communication with patients and families and eliminating gaps in care and coordination, and to improve the patient experience, reduce readmissions through the interdisciplinary care management process. Patients with sickle cell disease were identified as a population in need of care management. Sickle cell disease is a genetic disorder. It's a life-threatening inherited blood disorder affecting more than 100,000 Americans. It affects 1 out of every 365 African Americans born in the United States, and about 1 in 12 carry the sickle cell trait. Okay, next. So the bridge team care coordination process is that all patients admitted with sickle cell disease are referred to the complex case bridge team, which composed of social workers, RN care managers, and other support staff, including a therapist, including case managers and social workers, as I mentioned. The bridge team works closely with the patients and their family and as an integral part of an interdisciplinary care team. And the RN care managers provided education, medication reconciliation, assistance in filling prescriptions and follow-up appointments. The social workers provided psychosocial as well as family and community support post-discharge, and empowers the patient to advocate for their own health and well-being. Next. So at that point in time, some of the key problems were the readmission rate, patient dissatisfaction with their care, and the staff attitude in the ED, lack of PCP follow-up appointments, transition of care from adolescent to adults, and predominant patients of African ancestry, male and female from all countries that were treated. And the readmission, 7% of the 30-day readmission in Queens were from patients with sickle cell disease. And obviously there's a financial cost to readmissions and a potential poor HCAP scores and possible less than optimal health outcomes. Next. So the bridge team innovation, the focus that I wanted to really make sure that we did not confuse what was actually fact from what was a myth. And so we also wanted to eliminate the word drug seekers. It's a term that's used for patients with sickle cell disease. And I will show you in the next couple of slides that that's a myth and not a fact. And we instituted the sickle cell patient registry, the care management training program, and developed an implemented patient survey that had identified patient needs and concerns. We collaborated with the ED inpatient ambulatory department, medical directors to improve care for the sickle cell patient. And from speaking with the director of the emergency room, the ED visits and readmission was decreased, and the care manager and an assigned physician assistant were responsible for patients who came to the emergency room. And so there was a direct patient care with staff identifying patients with sickle cell, and also gave them the opportunity to sign up for the patient sickle cell support group. Next. So what is the perception versus the fallacies? Perception versus reality. Next. Okay. So sickle cell patients have a higher degree of drug addiction than the general population. That's a myth. Okay. The reality, next. The facts are opiate addiction for sickle cell patients range from 0.5 to 8% versus 3% to 16% in patients with other chronic pain syndrome. Behaviors often described in patients with sickle cell disease, such as requesting a specific dose of opioid for requesting that the opioid be administered intravenously may be normative in patients who have experienced a history of undertreatment for pain, less indicative of abuse than behaviors such as illicit drug use or use of opioids for symptoms other than pain. And this was really from an article in JAMA, which by Dr. William Zemsky, who's a hematologist, and the title of this article was Treatment of Sickle Cell Pain Fostering Trust and Justice. Next. So part of the whole idea of the bridge team was that we developed a sickle cell support group. And I thought I would share some of the statements from the patients who actually joined the group. As I said, in the emergency room, if the patients were in the emergency room, the care manager would discuss with the patient whether or not they wanted to join the sickle cell support group. And we ended up with about maybe 15 patients. And we had the support group meeting at lunchtime. We provided lunch, and it was an hour before hematology clinic. And I just wanted to share some of what we learned from hearing the voices of the patients with actually this really life-threatening disease. The pain is like a sledgehammer constantly hitting me up and down my spine. Yes, I'm a drug seeker. I need drugs to relieve my pain. I'm not someone just seeking drugs. If you have a cure for my disease, come in and talk to me. If you don't, stay out of my room. When I'm in crisis, the pain is so severe that I really want to die. When I'm home and feeling better, these thoughts go away. Next. Doctors and nurses do not teach me about sickle cell, about the disease. The disease teaches me. Interesting how a patient who actually has disease is very familiar with how does the disease affect that individual. I often ask myself, why me, God, and realize that there are no answers. I have goals and aspirations despite this disease. I have a 50% chance when I get admitted to any hospital that someone will be nice to me. Why did it take the hospital so long to recognize us? Is it because of who we are? And what we realized with the collaboration with the emergency room, particularly the emergency room staff and the head of the emergency room, we were able to collaborate with emergency room, inpatient, patients, and family through what we found out from the sickle cell support group as a part of the bridge team. And that's why the readmission rates went down. And in addition to that, there were assigned staff now in the emergency room that when a patient with sickle cell came in crisis, they would go and see the patient firsthand. Next. So what we learned is that improving patient trust is crucial to improving the lives of sickle cell patients. Trust starts with patient engagement philosophy that is non-judgmental. Effective transition of care process is important to patients and their families, and partnering with community-based organization is crucial to helping the patients in the broader context of the individual. Sickle cell disease, like other chronic disease, does not have to control one's life, and patients should make every attempt to control the disease and not have the disease control them. Next. And currently, in continuing this quest for making sure that patients with sickle cell disease are treated as human beings in any type of health system, I am currently on the advisory board in 2023 of Westchester Sickle Cell Outreach, which is a new community-based organization in Westchester. And I'm going to be having conversations with patients with sickle cell about how they have conversation with their physicians and the clinical team, and to make sure that they provide information, make sure they know who you are as an individual, and look at it from a perception reality as to who you are, and make sure it's the reality that's going to be the driver of your care. Your dreams and aspirations need to be shared and not to be referred to as drug seeker. Okay. Next. So at Kings County, which I was in charge of the congestive heart failure readmission prevention program. And I think back then, Medicare came out and said if the patient is admitted for CHF, within 30 days, they would only pay for one admission. Whereas prior to that, whether the patient came back 2, 4, 6, 8 times, they would pay for all admission. So every health system across the nation, if for no other reason financial, had to make sure to put a congestive heart failure readmission prevention process in place. Next. And so the team, and I use some of the concepts of the bridge team and also on the patient engagement processes, and to make sure that we are not judgmental, not to use the word non-compliant without asking why. How many times have you heard the word non-compliant? Every time I do presentations and training, everybody raised their hands. How many times have you heard the why? Why did John Brown didn't follow directions? No one. It's maybe 3 of the 60 people. So we don't know why John Brown didn't take the medication, but we were refilling the same prescription that that patient didn't take, and we have absolutely no idea why. And we want to improve patient engagement and cultural competency, identify African American and also Afro-Caribbean from a cultural perspective, and recognize and heighten patient value. And the other question that the team had to ask, so we want to find out who is the individual in that bed, what are the fears? The fear factors is not something that's discussed in hospital systems or even in private practice, because you could see how someone's fear could actually lead to non-compliance. But if you don't know what the fear is, then again, it's the negativity that you're going to be driving the ship, the perception. What is important to the individual? If I know what's important to you, then I'll be able to have a better chance of collaboration. And where is the individual in the acceptance of the disease? If I'm planning a vacation to go with my family and I took my mammogram and now I have a mass in my breast, at that point, I may not even know who I am. And so it needs to have some understanding how long it's going to take for an individual to accept the disease. Next. So the results of the interdisciplinary team, and it was an amazing team in both hospitals. We had a hospitalist, social worker, dietitian, a pharmacist, care case managers, home care, clerical associate, cardiologist as a consult, nurse, and patients. And over the course of time, we were able to, by the programs that was implemented, we were able to decrease congestive heart failure readmission from 30% to 18.7 in a little less than 2 years. The results, 30%, that was then from the medical director, and the 18.7 came from the Office of Medical and Professional Affairs. And it really had a lot to do with heightened human value and patient engagement and willing to have tell me why conversations. Next. So at Kings County, it's 93% of the population are from African ancestry, 60% of the patients are Caribbean, 35% are African Americans, 4% are Hispanic, and the Hispanic populations was predominantly Panamanian. And when you look at the history under colonial rule, the British sent the English-speaking Caribbean to Panama to do what? To build a canal. And that's why you see phenotypically, patients tend to look more people of African ancestry. For the patients that were non-African ancestry, 3% were white, 4% were others. Next. So the top, as I said, 80 to 90% of the African-American patients were from North or South Carolina. And when you look at the histories after the Emancipation Proclamation, that communities started to thrive. They built schools, they built churches, they built businesses. And over the course of time, the Ku Klux Klan came in and burned the place down, and they came up the coastline to New York. And the top Caribbean islands were Jamaica, Trinidad, Haiti, and Guyana. And as I mentioned, the 3 most common language was English, Haitian, Creole, and Spanish. Next. So I thought it's always important when I talk about patient engagement and cultural competence to hear from the patients who are actually in the bed. And what I said there in our hospital beds are not in the history books. And here are a few stories. Next. 84-year-old African-American female, initially from South Carolina, said, my parents were a step away from slavery and my grandparents were slaves. 82-year-old African-American who stated on a weekday that what I'm most concerned about is not going to church on Sunday. The role of religion in the Black elderly population and clinical care and the correlation between the two is pivotal to one's improving health conditions. Next. 78-year-old African-American female, initially from South Carolina, who was dissatisfied with her hospital experience, stated, I picked cotton in the South and I paid my dues and I don't deserve to be treated this way. How many of us in the healthcare system understands her point of reference? That's of a cultural origin. Next. So my recommendations to health systems based on my experience in these two hospitals. I want to share with you. So let's look at cultural competence. I know there's new words, cultural sensitivity, cultural humility. I would rather stay with cultural competence and sensitivity. Cultural competence is defined as the ability of providers and organizations to effectively deliver healthcare services to meet social, cultural, and linguistic needs of patients. A culturally competent healthcare system can help improve health outcomes, quality of care, and can contribute to the elimination of racial and ethnic disparities. Next. And I think at this point in our systems right now and where we are in healthcare, we have to recognize that cultural sensitivity has to be bidirectional. What do I mean by that? Foreign-born medical graduates to American patients, American physicians to foreign-born patients, and American physicians to American patients who are culturally different than themselves. And they need to understand the role of race, gender in the American culture and race and/or gender in the foreign cultures. And to recognize that currently, sadly, the English-speaking population is currently left out of the cultural competence requirement and conversation. So who are you leaving out? So the patient that said, I pick cotton in the South, does anybody put that in the cultural conversation? Next. So the common thread is what I think it's applicable to all human beings. Amid diversity, what do patients have in common? They don't have a choice about their disease. Once accurately diagnosed, the disease is non-negotiable. No one can give it back. In case of chronic condition, the disease and its symptoms may remain with the patient for life, and patients may be forced to change their lifestyle and/or job as a result of the disease. And at any point in our lives, we can be we as health professionals may become patients as well. And to recognize for the first time, the billionaire can't say, I'll give you $1 million to take the cancer back. Oh, that's not enough. I'll give you $5 million. No. And this is where the common thread lies across all races, ethnicities, religion, socioeconomic status, once accurately diagnosed. And maybe we could be more empathetic as an institution, understanding that. Next. So patient-centered care starts with giving the patient the benefit of the doubt, not be judgmental, increase empathy, eliminate negative labels as frequent flyers, drug seekers, high utilizers, non-compliant without asking the why question, and recognize that the average healthcare professional is healthier than the patient population and most have never been hospitalized. Next. We're almost there, and just define. And what have we learned? Behavior starts with healthcare professionals and executives. Professionals and patients share the same human concerns and emotion. We could all be patients at any point in time. Illness trumps religion, ethnicity, race, and gender and culture. Historical trauma can influence patients' behavior. And terms such as frequent flyers, non-compliance, that I mentioned before, over the course of time in health settings, create a culture of callous disregard. A culture of callous disregard can negatively impact patients' health and safety and thus affect patient compliance. Then recognizing also that we can all be patients at any given point in time. Next, and just the final slides. Staff instructions from a patient. For me to change from the bush tea, which is medication in a Caribbean patient who wants to treat all his disease using the bush tea, tell me the severity of why you want me to add 1 or 2 medication. If you want me to take 3 or 4 medication, you have to personalize it, man. Patient-centered care. Who knew? From the voice of a patient. Next. Almost done. And just one communication. This is just interesting. During a patient 2 weeks follow-up appointment with his cardiologist, he informed me, his doctor, that he was having trouble with one of his medications. Which one, I asked? The patch. The nurse told me to put on a new one every 6 hours, and now I'm running out of places to put it. I had him quickly undressed and discovered what I hoped I wouldn't see. Yes, the man had over 50 patches on his body. Now the instructions include removal of the old patch before you apply the new one. And next. And so just since this is African History Month, I thought it would be important to share that As we improve our communication with our patients and each other, it may help to know that Henry Sampson Jr. invented the gamma cells for mobile phones and wireless communication. First African-American to obtain a PhD in nuclear engineering in the United States, and communication has power. Next. And just memorable quotes that is embedded in my brain. Difficult patients are not just born, they are in part created by their passage through the medical system. Not only has the system failed to cure, it may have done unpleasant things to make matters worse. And from Hippocrates, it is more important to know the person who has the disease than the disease who has the person. Imagine Hippocrates knew that thousands of years ago, and we're just learning that now. Thank you.
Thank you very much, Dr. B. Before we move on, hopefully you remember this one, but could you tell the story of the patient that when we look at a non-compliant and asking why, the patient that was non-compliant with his medication, the bus driver?
Oh, the train driver. Okay.
Yeah.
So a 60-year-old African-American male recently diagnosed with congestive heart failure returns 2 weeks later, heart failure decompensated due to non-compliance. So since we were responsible for all the patients that were admitted, he was admitted to our unit and our team was responsible for that patient. And so we want to know why, and again, nothing in the record explained why. So we asked why. So tell me why you didn't take the medication. I can't take the water pill, the diuretic, which is a major medication to improve a heart failure. And it makes the person urinate a lot to get rid of excess fluid. Why can't you take the water pill? He said, because I drive the number 7 train. So when we look at the medical records, where did it say? It didn't say what his job was. And so we brought in the cardiologist and we said, what do you do when is your shift? He said 11 p.m. to 11 a.m. What do you do when you get home? He said, I do some chores. I have my breakfast and but I take a nap, but if I'm going to be on my shift, I don't take the water pill. So then the cardiologist said, okay, why don't we do that? Take the water pill when you get home. Be aware it may wake you up during the day, but by the time it gets to your shift, you won't have less of a reason to want to urinate. And so to the degree that you do, we're going to give you a cubicle to use in your private space, because in the driver's space is a private space. And the patient's response, that is fine. If I knew I had to choose between peeing and breathing, I would have chosen breathing.
Thank you very much. That always, it always stays with me when you talk about being non-compliant and asking the question why, because, working in the healthcare industry, clinically and non-clinically for so many years, I never thought about it until recently when we met and we had that conversation, how important that why is to the care of our patients. So thank you very much.
Thank you.
Let's see, technically we will do this. Oh, okay. Next we have, and a point of information. Remember to add your questions and comments to the Q&A box. We'll be pulling from those at the end of the presentation. And that's really where we'll get interaction with those in attendance and get feedback and get their questions. So please follow through with that. Next we have, okay, our next speaker is Lissa Mariel Southerland, Executive Vice President and Chief Operating Officer of Rise and Ground, a human services organization. And of course, I mentioned that she is my daughter. Now, sometimes it is hard to wake up and follow the news to hear of so many societal issues affecting the poor, the sick, children, and the elderly. You just get sort of depressed when you think about what's happening. And these things are happening in our country and in our communities. Example of what I'm talking about is, lack of basic health care, food insecurities, juvenile justice issues, child abuse, issues with children and immigration specifically. And keep in mind that when we look at these issues, many of those is what we refer to as social determinants of health issues. And so you get the press and you say, all these things are happening. And then you say to yourself happily, many times you say somebody out there should be doing something about these issues. I'm busy, I'm doing my thing over here. Somebody should. Well, let us have Ms. Southerland tell us what she and her organizations are doing to minimize the impact of these societal issues. Mrs. Southerland, you're on.
Thank you so much. Hello, everyone. It is nice to virtually meet everyone out there who is attending this evening. Thank you to everyone who allowed for me to share a few thoughts this evening in honor of Black History Month, which is super exciting. So I'm going to go ahead and share my screen and I will get started. There we go. So the theme for this evening that was shared with all of the panelists that we're happy to share with you is she believed she could, so she did. And so I want to share with you just for a few minutes from my lens as a nonprofit executive here in New York City, what that really means to me, especially in honor of Black History Month and in honor of being a woman of color in leadership. So once again, I'm Lissa Southerland. I'm Executive Vice President and Chief Operating Officer for Rising Ground, which is a large nonprofit here in New York City. And so I'm going to give you, in the context of my presentation, just a little bit about Rising Ground, because I think that's really important, not only because it's my day job and I'm passionate about what I do in the nonprofit space, but I also think it speaks to just some of the challenges that various underserved populations have, most of them being folks of color. So just to give you a snapshot of what Rising Ground does, we are a nonprofit social service agency here in the heart of New York City. We have over 80 programs, over 90 locations across all of the boroughs, and $150 million or so operating budget. Oops. And so I want to start by just saying, and looking in the box here in the center, as a woman of color, as a woman, first of all, I've had many challenges to sort of get where I am today. But I love this visual because it really highlights what some of the things that women in general, but also women of color here in their sort of day-to-day comings and goings as it relates to their workplace. A lot of times we have to work sort of extra hard to climb the corporate ladder, if you will, and especially folks of color. And so that's really the lens and the landscape that I want to share just a few nuggets today from. I also want to just include and give you a little bit more information about Rising Ground. So we help tens of thousands of New Yorkers across New York City, many person supported, most of them are folks of color. And just to give you a snapshot of just some of the services that we offer. So we have foster care services, adoption services, again, helping the most vulnerable populations in New York City, specifically families of color. In addition to that, we run the gamut from everything from juvenile justice programs for those that have been incarcerated and are now coming out and trying to establish their lives again, specifically focused on youth in juvenile justice programs. We also have a robust residential treatment program, which is for youth who have behavioral concerns that prevent them from operating in their normal family unit. Sometimes these youth are formally incarcerated, sometimes not, but for whatever their behavioral challenges are, they just aren't able to operate in their normal family environment. And so they stay with us within our residential treatment center, which is located on our Yonkers campus. We also have Beyond School and our preschool program, which are for preschool, elementary, and high school youth that, for whatever reason, they have various behavioral concerns, which can run the gamut of everything from autism challenges all the way up to their current IEP, which is their plan that allows for them to attend school, doesn't allow them to thrive in a normal school setting. And so they come to us and they obtain their school, their day program for school. We also have other services. Again, mother-child program, that's for mothers that are on the verge of homelessness with their children. We have a TIL program, which is for women who are on the verge of homelessness and need a stable place to stay. We have a bunch of preventative programs and community-based programs, everything from health navigators to outreach programs. We have an Article 29 medical clinic, which is specifically for our foster care kids, and a robust amount of mental health services that run the gamut for the entire family. And one of the central programs to our overall operation at Rising Ground is a program called Passage of Hope. And this is a program for the migrant children that come to us from the border. Many of you may have seen it on the news, although it's not as exciting as what you often see on the news as it relates to the kids coming across the border. But we have a very robust program that allows for us to provide sometimes sex trafficking victim assistance, as well as different programs for the unaccompanied minors that cross the border. So basically they come to us, they stay with us for anywhere from a couple of weeks to a couple of months. And our responsibility is to make sure that they are placed with whoever is here in the United States. That could be anyone from a parent to an aunt, an uncle, a sister. While they're with us, they are also going through schooling. We give them schooling to provide. Many of them come with English not being their first language. And so we try to provide them ESL classes as well as other sort of daily life classes to get them ready and acclimated to America, because many of them have had a very traumatic goings of it in terms of coming over from the border. And so it's our responsibility to stabilize them and then eventually get them placed with their loved ones. And so today I just want to give you a few nuggets, specifically from the lens. I often get, being at one of the largest nonprofits here in New York City, and especially as a woman of color in leadership, the question that I'm often asked, I get asked this from my staff, I get asked this from my mentors, various friends, family, those that have sort of seen me work, I feel, as hard as I have to kind of get to the level that I am. One of the questions that I often get is, how did I get here? And what do they have to do to get to the level that I am? There was a great article that came out in Forbes, and I did put the link below. I'm happy to share this presentation with the group as well. It came out in 2002, and it really went into depth about how women of color are changing sort of what the landscape of leadership and what the workforce look like. It's a very interesting article. I encourage you to Google it and read it. It really gives sort of a good landscape in terms of where we are as women of color, how far we've come, and all the challenges that we still have to go. And so when I get the question, and I thought this was very sort of apropos in light of it being Black History Month and being a woman of color in leadership, I sort of put it into 5 buckets or pillars in which the ways in which I feel like I have become as successful as I am in the nonprofit landscape. And that's really the question that I often get. And so I put it into 5 buckets, which I'm going to share with you today. So the 5 buckets are aligning myself with my organization's mission. I'm going to talk a little bit about DEI, pulling up a seat at the table, right? We often hear that as women of color or just women in general, that we want to make sure that we have the same amenities that our male counterparts have. So it's just about, what does that exactly mean? I'm going to elaborate a little bit on that. I'm going to talk about paying your dues. I'm going to talk about advocating for yourself and allowing for you to have a little grace as you go through your workplace journey to get to the level that you ultimately want to be. And so I want to talk just a few minutes about aligning yourself as it relates to organizations that have a strong DEI mission. Rising Ground we consider ourselves an anti-racism organization. And it's our responsibility to advocate not only for our persons supported, many of them, most of them being folks of color, but also our staff. About 80 to 90% of our staff are folks of color. And so it's really important to us to align with that in terms of our mission. And for me, as a woman of color, as I began to move through my career, I tried very much. And I think at Rising Ground, I probably hit it over the mark the most in terms of all the different organizations and companies that I've worked for. But I've tried to align myself with an organization that has some sort of DEI lens. And I'm going to give you just some examples of things that we're doing here at Rising Ground. Some are doing less than we are. Some are doing more than we are. But I think as a woman of color in leadership, as you are aspiring to move up the ranks in whatever area you work in, it's really important to make sure that your organization has some alliance or priority to DEI efforts. So just some of the things that we do at Rising Ground. Over half of our leadership team, if not more, are persons of color. Most recently, we just hired an SVP of DFB. So instead of diversity, equity, and inclusion at Rising Ground, we use the term diversity, fairness, and belonging. And so we hired a senior level executive to oversee those efforts, which is just absolutely amazing. Other ways that we look in terms of the lens of our mission of including DEI is we have anti-racism practice advocates, which are in an interdisciplinary group of staff that are helping our SVP of DFB to move our anti-racism and diversity initiatives forward. We have anti-racism work groups, inclusivity work groups. We have a diversity guiding document, which guides all the work that we do, as well as a robust amount of advocacy efforts. And then the third thing as it relates to DEI and in the lens of a woman in leadership, I think the question that you should ask yourself is the organization not only looking forward as it relates to DEI, but are they turning back and trying to help those behind them? And various ways that they could do that, and we do that at Rising Ground, is through our recruitment efforts. So trying at every turn to make sure that we continue to prioritize where appropriate, hiring folks of color, and also using opportunities to hire from within. Many times, the folks that we work with, especially our staff, if they were to go to another organization, may not elevate as quickly as we prioritize to elevate our staff within the walls of Rising Ground. And so that allows for us to really have good retention and to really help keep our folks of color moving forward. And so just to give you a little bit of data, because the data always speaks for itself, right? So McKinsey gave one data point that says every step of the way, women of color lag behind men and white women on the corporate ladder, leaving them severely underrepresented at the executive level. In 2021, women of color composed just 13% of C-suite roles. We know that when companies put measures in place that focus on achieving more gender diversity, women of color often lose out unless there's explicit focus on race as well as gender. So women of color have sort of two check marks in the negative in terms of the fact that we're women, and we already have challenges, as we all know, or for the women on the call, as it relates to just moving up the corporate ladder just as a woman. But then when you add on being a woman of color, we are disproportionately behind our non-women of color counterparts, which often creates challenges. And often for many women of color, it allows for them to just sort of lose hope that they never will get to the level that they ultimately want to be. I love this slide because this really walks you through what it feels like for many women of color as they try to move up the corporate ladder. Or any ladder, whether it's in the corporate world, in the nonprofit sector, the medical sector, regardless of what arena or area you work in, oftentimes women of color will say that they experience this sort of diagram here. And so to quickly walk you through it, women of color, they come into an organization, many times the leadership of the organization does not look like them and could be predominantly white. They are sort of considered that one sort of token hire of being that person of color. They start really happy. They go through what they call the honeymoon phase, where a woman of color feels very welcome, needed, happy, really enjoying their job. And as they start to progress, you start to see some of the negative aspects come into the workplace as it relates to those folks of color. So especially women of color. So when the reality starts to set in, she starts to think through and realize some of the issues that are coming along with either her role or how she fits into the organization. She tries to continue to work within the organizational structure. She pushes for accountability on certain aspects. She could begin to encounter things like microaggressions from those various non-folks of color in leadership. She starts to get frustrated, but still tries to push forward in a positive way. Then she may or may not, but often may start to find examples of racist or racism type of issues that are happening to her as a woman of color. Some are explicit, some could be very non-explicit. She tries to bring that to her organization. She may get blamed for it, right? And then she kind of becomes the target. She sort of feels like she's on the outside looking in. You know, she continues to try to communicate that through the normal channels, whether that's HR or other areas. In the same way, in the same vein, also trying to be that person trying to move up the ladder. She could then be targeted, she could be attacked in some way, and then ultimately she gets frustrated and she leaves the organization. And so this is the cycle that often happens to women of color, and this is why disproportionately there are so few women of color in leadership, because they never get the opportunity to get all the way up to the glass ceiling or even try to shatter it, because they've gone through this sort of visual that you see here, and it becomes very frustrating and they decide they just want to move on. And just another statistic to sort of throw out there, 4% of in many organizations across where the statistic came from, 4% of C-suite positions are women of color. So that means 96% aren't, which is a very stark realization, especially for those women of color that are aspiring to move forward. It's like, will I ever get to that C-suite? If you aspire to be in that C-suite position, will I ever be that doctor, that lawyer, that professor, right? Will I ever get to the higher levels of leadership? Will I ever have a seat at that table? And when you see these sort of grave statistics like this, it could sort of place you in a position where you feel very disgruntled. You may feel like you're never going to get there. And so sometimes you don't even try, whether that's you may have aspirations to move up the ladder in terms of getting additional education credentials. And sometimes we just give up and decide we're not going to do it. And so this is a quote that I love, and it really, I've carried this with me, I think, throughout my career in some way, shape, or form. Shirley Chisholm said, if they don't give you a seat at the table, you need to bring a folding chair. And I think that really speaks to women of color, and the fact that even though we have these challenges, if you aspire to move up the ladder or the ranks in whatever organization or company that you work for, you need to make sure that you have a seat at the table. And so if a seat at the table isn't presented to you, sometimes you just have to bring a folding chair. This other visual on the right side just gives you some additional statistics about women of color in the workplace and breaks it down in terms of non-women of color versus women of color and kind of senior level positions in some areas of leadership. And again, it just speaks to my original point of how grave the statistics look as the higher you get within leadership. So one of the pillars that I mentioned earlier, and I told you that I was going to be giving you 5, is it's important that when you're trying to move up the ladder in whatever that means to you as a woman of color, you can't rush it. You have to make sure that you pay your dues. And it's taken me many, many years to get to be a chief operating officer. That was always my dream. And my mom can tell you, even from when I was younger, sort of going through college, trying to find my way, I was very drawn to the operations arena and the operations space. So I knew one day I wanted to aspire to get to the level of chief operating officer or even beyond that. But it was important to continue to tell myself that I have to make sure that I'm paying my dues. I can't rush the process. I have to do my research. I have to keep building my accomplishments. I have to seek mentors. And I think my co-panelist, Ellie, mentioned that in her presentation. Mentors are really important, and they're a good stepping stone as you continue to move forward. I have to build my skills. And sometimes it's important to just be in the room and not say anything. And so I early on in my career learned that, and I always try, even where I am now. Sometimes my staff will say to me like, oh, you came into a meeting and you didn't say much. And sometimes you don't need to say much. You just need to be in the room at the table, observing, especially observing those that you feel like one day you want to be. So I would encourage everybody, sometimes you don't have to speak in the room. Sometimes you can just be in the room and not say much. I also think it's really important, this is also one of my pillars of 5, that you advocate for yourself. You can't be afraid to advocate for yourself. One of the scariest things when I talk to fellow women of color that they're scared to do in their career is advocate for ourselves. And I can tell you personally, that's one of the hardest things that I've had to do in my career, whether it's advocating for a new position, a promotion, whether it's advocating for a salary increase, whether it's advocating for you wanting to increase your scope in some way. It's really hard to step in front of non-folks of color sometimes and advocate that you're the best person for that position, that title, that salary, whatever it is. But you have to build that confidence because only you are able to advocate in the strongest way for yourself. Sometimes it takes years of practice of that. And I can tell you firsthand, it's definitely taken me years to figure out the skill sets involved, the confidence that comes with advocating for yourself, but it really is an important skill set and one that you should continue to learn and build. And also, I think it's really important to give yourself grace. Success takes time and you make lots of mistakes along the way, but you have to keep trying. If you have a goal, if you have a dream, regardless of the fact that you're a woman of color and you know the challenges that you're going to face, there are statistics. I've just mentioned some of them here today. You may talk to fellow friends and family who are also folks of color that are navigating some of those same challenges. But I am definitely an example of if you keep trying and you have a goal and a dream, and I know that sounds cliche, a lot of times there are like quotes out there that talk about, achieving your goals and dreams, and that's so important. And you can do anything you set your mind to, right? I know we've heard that adage, but it's really important that if you have a goal, you have a dream, you need to just keep pushing it and give yourself grace and time to reach that, whatever your success means to you. It's important that you just keep pushing and allow for that success to come to you. I am definitely an example of the more you sort of make those mistakes, but keep getting back on the bike and keep running or keep biking, the stronger you're going to be. And I guarantee you that if you're good at what you do, ultimately you will get to your end result. You just have to make sure, and that's not only in your personal or in your professional life, but that's also in your personal life. Sometimes you just have to give yourself grace. And I include that for all of my women of color out there who are sort of navigating the workplace and trying to figure out how to do this and feeling like there's sort of competitors around you and all of you kind of going for the same opportunity. But if you are the person to get that opportunity, it will come to you. So you have to just make sure that you're giving yourself grace to achieve that. And I'll end today by one of my favorite visuals, and some of you may have seen this. It was actually trending on Instagram a few months ago, and I've seen it pop up on LinkedIn and various other sort of social media spaces that I frequent. And so this is just a picture of a woman sitting in front of a panel of men. Some of them, it's very interesting. Some of them are sort of not paying attention to her. They're kind of leaned back and very relaxed. Some of them kind of have their hand on their cheek and aren't really interested in what she has to say. And so this is often what happens to women of color, really folks of color. I'll include men in this sometimes as well, but specifically for my women of color out there, sometimes we sit in front of panels that look just like this. I've done this throughout my career countless times. And so the bottom of this, when you see it streaming or trending on social media, the bottom of it says, describe what you bring to this company. And so sometimes when you're being interviewed for a job or you're going for a promotion, they want to know what you bring to this company. And so aside from the fact that you may have the credentials, you may have all the expertise, you may have the experience, you may have all the educational credentials that you need, you have to set yourself apart from the other people that they're going to be interviewing. Oftentimes when I interview staff who work underneath me in my division, one of the questions I often ask in interviews is, what sets you apart from the other people that I'm going to be interviewing today? And I love to hear the various answers that I get to this question, because sometimes the answer to that question does set them apart from the other candidates that I might be interviewing for that role. And so I encourage all of the women of color that are on this presentation and this webinar today to think about that question. Describe what you bring to this company. You have to set yourself apart from the other competitors that may be coming behind you. And you have to always remember that you have challenges just by being a woman of color, but you always have to put your best foot forward and really set yourself apart from others who may be coming behind you. So I love this visual. I keep it up at my desk. It's just always a reminder of how far I've come as a woman of color. And I still have goals, dreams, aspirations, and things that I want to do in the future. But I think it's important, especially in light of it being Black History Month, for all of the women of color out there to just think through a little bit further, whatever your goals, your dreams, your ambitions are as it relates to your work environment, your workplace, whether that be a promotion or what have you. Just continue to strive for your dreams, because I'm definitely an example that anything is possible. Thank you so much. And I'll turn it back over to the moderators.
Thank you, Ms. Southerland, Ms. Lissa.
You're welcome.
Moving forward, this is so exciting, because as I listen to these women in the totally different arena of business and total different ways of contributing to the welfare of the Black community. I'm learning so much, and it's very exciting. At least for me, it's very informative and it's very exciting. Now, we're talking about when we said she believed she could, so she did. And in my past life, and I think in my future life, one of the things that I always wanted to do, one of the things I would have loved to do, is join the military. If nothing else, it's because I'm really excited about the actual uniform situation. But with us today, we have someone who actually believed that she could, and she did. Our last presenter, and definitely not least, is Dr. Annette Tucker Osborne, Colonel, retired United States Army, Armed Forces. And, I really encourage you to read the bios of the presenters. I don't go into, much detail, but it really makes a difference when you read their background, and it gives you additional information as to, their point of view, where they're coming from. In addition to a retired colonel, she's a registered nurse. She's a licensed nursing home administrator, a member of a number of organizations at the local level and also at a national level, and recently elected the 6th president of the National Association of Black Military Women. And her organization oversees all the National Association of Black Military Women chapters throughout the United States. That's a big job. And we're talking about overseeing military women. She's also a member, as she mentioned earlier, of the Black Long-Term Care Executives and the Healthcare Executive Club. Dr. Osborne is really going to talk to us about, what it was like in terms of military women, and some insight into what it was like for her in the military. So with us, with any further ado, Dr. Tucker Osborne, you are on.
Thank you, Marcia, and good evening, everyone that's on the panel and our audience. It gives me great pleasure to be on this panel to talk a little bit about Black history. It being Black History Month, we want to focus on the intentions of African Americans in the United States. I know Marcia spoke a little bit about me. I don't really want to speak too much about me, maybe at the end, but I do want to talk about, and we've all said, I love that motto and the theme that we used, she believed she could, and so she did. I would like to tell you about some fantastic women who did just that. Ladies and gentlemen, I would like to introduce some women who, like I said before, they believed they could and they did. And these women are called the six, you see it as 6888, but it's really this, we call it the 6888. Yeah, a little bit of history. So did you know that in 1944, Mary McLeod Bethune worked to get the support of Eleanor Roosevelt for a role of Black women in the war overseas? Black newspapers too challenged the United States Army to use Black women in meaningful Army jobs. The women agreed and signed up to basic training. Now, this is the battalion, the 6888. So who are they? They're American women. They were called back in the day Women's Army Corps. They were assigned to Birmingham, England, Rouen, France, and Paris, France during World War II. November of 1944, 824 enlisted women and 31 officers were recruited from the Women's Army Corps. Also the Army Services and the Army Air Forces to form the 6888. And it's called the Central Postal Directory Battalion. Now, for any of us, and I don't know how many military are on this call, but I know that when I was deployed in Kuwait for over a year, you look for mail, you look for your loved ones and your friends for whether it's one letter or even if it's a package. So just imagine that men and women had not received mail in years. Would you believe years? This woman here, Charity Adams Early, was the first African-American to be an officer in the Women's Auxiliary Army Corps, later known as the Women's Army Corps. She was the commanding officer for the 6888. It was the only unit of African-American women to serve overseas during World War II. Adams was the highest ranking African-American woman in the Army at the end of World War II. She passed away January 13, 2002. Now, look at the mail. I'm going to look at this mail. Can you imagine? They were given a time frame to get this all together. So I just want to look here. So when the 6888 was settled in Birmingham, they saw letters stacked to the ceiling of the temporary postal office in an unheated converted hangar. Dozens of letters had been in the makeshift office for as long as 2 years. Imagine that. Many letters and packages had only first names of the intended recipient. So can you imagine how they would try to get, I don't know why my face is going crazy like that. And I'm not moving. It looks crazy, right? Let me put myself on off camera for a minute. Oh, did it stop? Okay. Stop laughing, Marcia. Okay, these women kept mail flowing to nearly 7 million soldiers in the European Theater of Operations, better known as ETO. Early in operation, a white general attempted to send a white officer to tell them how to do it right. But guess what? Major Adams, she responded, "Sir, over my dead body." I love that. The battalion completed what was to be a 6-month task. The women completed this in 3 months. Picture that. Again, you see all of this mail? Okay. Now they're here, ending sexism and racism. And we talked a little bit about that with Elena's presentation regarding school and education. The women of 6888 received high praise for their work upon recognizing service members thank them in the streets. Still, they face discrimination due to their color and gender. According to the National Museum of the United States Army, several Black male service members assumed that the women were sent to Europe to provide companionship. A notion the women of 6888 quickly set them straight. When the Red Cross denied them entry to their club and instead opened a segregated club, as you see here, for the women, the battalion never set foot in it to show their united disapproval of such women. According to the museum, some of the unit's recreational basketball players were invited to play on the Army team. However, the invitation was rescinded when the Army learned that the women were Black. And here they are again. These members of the unit died in a Jeep. These members here died in a Jeep in early 1945. The War Department didn't provide funds for their funerals. The unit gathered its own money to perform the services to bury the fallen women in Normandy. Long-awaited accolades. The 6888 Black military women were honored with a monument, and this is in Kentucky. These ladies on to my right of the screen, they were the only women that are still alive. President Biden signs for the World War II Battalion. I don't know if anyone's seen this on the news, but they received the Congressional Gold Medal for this. I mean, it's about time. You're talking about 1944. And here's Speaker of the House, Nancy Pelosi. And here are some of the women on the left side, I'm sorry, on the right side, who attended in Washington. This lady here, Lena King. Lena King on January 27th, 2023, celebrated her 100th birthday. I sent her 2 birthday cards and she answered back. This young lady to the right will be one of the actresses that are going to portray her in Tyler Perry's movie. And I'm not sure if anybody has seen not the trailer, but it's on Facebook and it's also on LinkedIn and Instagram that he is going to do this. This lady to the left of you, she's my public relations officer, and she attended Lena King's 100th birthday. So Tyler Perry takes on the true story of the 6888. Wait a minute. I just saw, but I don't have it on my screen. Kerry Washington is in it. She's playing, I don't know if she's playing the early years of her or the later years. I showed you this lady, this young lady is playing, but I'm not sure what age she's going to portray Miss King. Oprah Winfrey is also going to be it, and they're already in production already, because I saw a link where Kerry Washington is already in the uniform. So as the president of the National Association of Black Military Women, as Marcia told you, and a retired colonel, I stand on the shoulders of these women. But I do want to say a little bit about racism and workplace. I want to go back to Lissa's, one of Lissa's slides. It's not only, just civilian where you need to be at the table. When I was deployed to Kuwait, my commander did not know my race. He only went by my name and my military resume. When he saw me, he asked me to step outside of the room. It was all of the soldiers now, and we were all introducing ourselves. It was, I think it was about 40 or 45 of us. We were in Fort McPherson, Georgia, ready to do a lot of training before we are deployed to Kuwait. So he came up, he asked me to come outside of the classroom, and I'm wondering in my head, okay, so what's going on? What did I do? So he says to me, and now we're both the same rank as colonel, but he says, ma'am, are you up for the challenge? And if anyone knows me, I know Verna and Marcia knows me. My face can say a whole lot of stuff. So I had to put on another type face. And I said, sir, what you see on that resume is me. Now, there was also a white female colonel also there. So I'm trying to figure out, so what is he saying now? He sees her. Is he trying to replace me? But guess what? She's a psychiatrist. I'm a nurse. So that's not going to work. He is not even a medical person. And I'm wondering how he even became the commander of a medical unit. He's an educator by profession. He's a Caucasian man. I'm a Black African-American female. But guess what? During my whole tour there, who covered his you know what? I did. And when he met my husband, he said, you know, she really commanded this unit. And I wanted to say, you know, you're right about that. So, you know, it's in both type of workplace, both civilian and military, that I still have to, you still have to strive to get that rank. You know, I crossed my what is it, dot my I's, cross my T's. I did all of that, went to every training. And how dare you think that I cannot do this role as the chief nurse of a brigade? I was a chief nurse of a brigade in Staten Island, New York, and deployed over there, and was overseen. I can't even tell you how many soldiers over there. So she believed, I could, and I did it. Thank you.
Thank you very much. Thank you very much, Dr. Osborne. Annette, you said Marcia and Verna knows me, and we sure do. And when we say she believed she could, so she did. And the question that they ask you, are you up for the challenge? I definitely can say yes, we are up for the challenge. Just listening to the four speakers tonight, and you know, this concludes the actual speaker presentation. We have a little time, and we'll get into some questions and answer. But just listening to the speakers, I definitely can make that statement that we are up for the challenge. Definitely enjoyed the presentation. Now I have quickly, because we don't want to run out of time. I'll start with, I have lots of questions, and I have a comment, actually a comment from Dr. Annette Tucker Osborne, commenting to you, Lissa, saying that that is so true. We must advocate for ourselves, and that she did that in the civilian life as well as the military, which is the comment that she just made. So you know, it's an ongoing process along the continuum. Wherever we are, we definitely have to do that, advocating for ourselves. And then also I have from George Carballo, and he thought that your example that you gave, Dr. Beverley, the story that you gave, the one that we talked about, the bus driver, was very good. He enjoyed that one. I also have a comment from an anonymous attendee referring to your presentation, Dr. Beverley, and it says, excellent review about the lack of response to sickle cell patients. I have the disease trait. Only one physician in my lifetime tested me for it. And that was 30 years ago. So, you know, we still have a very high, steep hill to climb and the process continued. And so one of the questions that I have when I read that was, from a testing protocol perspective, Dr. Beverley, is there a specific tests that, we have that would determine offhand that we have sickle cell?
Yes, from what I've read, it's part of the newborn screening now.
Mm-hmm.
So newborns are tested for sickle cell as well, and it's part of the screening process.
Okay.
And so the difference is if you're in your 30s or in your 20s and you've never been tested before, but you may not know. But by the time, if you get sick and you got into sickle cell crisis and you go to the hospital, you may not know that was sickle cell, but they will address that issue for you. Yeah.
Okay.
But they definitely do newborn screening is the big thing right now.
Okay, great, thank you. And we have Alpha Omega Owusu, and he said kudos to your presentation, Lissa. So let's see if we have more. Eunice Richard commenting, great presentation from all the panelists, grateful for all the knowledge shared. Now, I have a question for Dr. Sifford. What are the requirements to become a tenured professor?
Yeah, so it depends on the person's field, but generally speaking, the person would need to have what's called the terminal degree in their field. So I'm in art history, as I mentioned, and the terminal degree in my field is a doctorate. However, for example, I have colleagues who are professors of the studio arts, and their terminal degree is an MFA, a Master of Fine Arts. Similarly, for example, if you were to be a law professor, your terminal degree would be a Juris Doctorate. So it varies dependent on what field you are in. It is usually some sort of doctoral degree, although for certain areas, it might be a master's degree. So that's the requirement essentially to apply for and to be considered for the vast majority of tenure track jobs in the professoriate. And then in order to then achieve tenure, you would have to meet the requirements of that given institution, which is usually tied to measurement of success in your research, your teaching, and your service to the institution.
Now, service to the institution, is it standard like in other industry service in terms of, showing up for work on time, doing presentations? I mean, what service looks like?
Oh, yeah. So that could be a number of different things. And it relates very well to the theme of this webinar because of the fact that women of color, we tend to do a lot of what's sometimes referred to as invisible labor. Things that aren't necessarily measured by the institution, such as some of the acts of mentorship that I spoke about in my presentation, where that could take up a lot of time helping students to the best of my ability, particularly those who may not be from as privileged backgrounds as other students who would have more familiarity with how to navigate an institution of higher learning, but that might not be quantified by the institution. So one of the important things, and it relates to what Lissa Southerland mentioned, is to make sure that you speak up for yourself and that you make it clear that you are doing these things. So even if it's not in the criteria, which 9 times out of 10, it's not going to be written into the faculty handbook that says, if you're helping students with XYZ, this counts as service institution. Usually those things are things that are more visible, such as chairing a committee or being a member of a committee or being the secretary of the faculty or something that is very visible to check off boxes that you're saying, okay, well, I am serving institution in XYZ way. So speaking up for yourself and saying, look at all these students I mentored and look at the internships that I helped them to get and the number of applications that they submitted so that they could move on to the next step in their career. All of those things should be counted as service, and we need to speak up when we're doing those things to make sure that those in higher level positions know what it is that we're doing.
Great, thank you.
Marcia, Marcia.
Yeah.
So I'd like to say something.
Sure.
All of the presentations, they so relate to both civilian and military. And what I want to say is, Lissa, one of your other slides had the woman sitting with all of the men at the table there. So I've had a situation, but I stood up. I stood up. I'm not sitting down. So when you stand up now, they like, oh, because I learned that from the military. If you fall asleep, the commander comes and he puts his hand on your shoulder. So I said, I'm going to stand up. With Dr. Beverley, I wanted to talk a little bit about your experience with foreign medical grads as opposed to American physicians. So the other way is in the VA hospital, which I'm a patient, you know, I go there. We always get upset because the civilian doctor does not know a lot about the military situations. You understand? So if you go in there with PTSD or any other ailments, they have such a high turnaround of you know, they leave and then you get another doctor, another civilian doctor. He doesn't know, he hasn't been deployed, he hasn't been in the military in a sense he can relate to you. You want somebody that can relate to you. I mean, I purposely asked for a female doctor. So I go to Women's Health. Okay, now they just changed me. This is my third one. I haven't seen her yet. I got my letter, then now this is my third one. So I know I have an attitude already because now I got to deal with a whole, again, they're all female civilians. I have not met a doctor yet that was a military doctor. When I went to claim my disability, they sent me to a civilian doctor so I could do my claim. So a lot of this, you know, is kind of go hand in hand with what Lissa said, what Dr. Beverley said, what Ellie said about certain things. You know, I 2 years ago, I just got my graduate degree. But again, my cohort was only 2 of us, and the rest were, you know, white, Caucasian female, not Caucasian female, but Caucasian students. You know, it's not easy. It's not easy to even get the doctorate, and when you get it, you know, you don't see you in it.
Yeah, absolutely, absolutely. That's why we're here. I have a quick question for Lissa, because we're coming close to the ending of our presentation, and that Lissa, the funding for Rising Ground, you guys do such great work, and obviously I'm familiar with that. Where you get your funding from? Donations? I mean, how does it work?
Sure. So primarily we are government funded. So we get local, city, state, and federal funding. That makes up the brunt of what the funding that we get. But we also have a robust fundraising operation. So similar to other nonprofits, you know, when we talk about galas and some of the other ways in which we fundraise, we have that engine moving all the time because unfortunately, government will give us enough to fund the program, but when it comes to sort of going above and beyond and really having programs of excellence, we need that additional layer of fundraising dollars to sort of make ourselves whole and be able to provide the best service for what we call our person supported or our clients. So that's really the main ways in which we get funding. And I just wanted to, I know we're running out of time, but I wanted to just piggyback on what Ellie said in terms of sort of that invisible layer, I think you called it, in terms of, I think it's really important. And I think all of us would agree on the call, or invisible work, I think you said, you know, it's that for me, being a woman of color is probably one of the most important things that I do in my job. I love the fact, and I'm very proud of the fact of the success that I've achieved. And I think all of us on the call would agree with that. But I think we're only as good as if we turn around and reach back to those that are coming behind us, because we know that some of the challenges that we've faced and that they will face. And so doing that sort of invisible work, whether it's networking with organizations, whether it's mentoring to those that are coming behind us so that they see an example of us as they move forward, I think that's probably one of the biggest things that we can do. And one of the things that I love to do. I mentor a lot of different women of color at various levels within their career, both intangibly or tangibly, as they're moving forward, just for them to be able to reach out to someone in a certain situation within their workplace and say, hey, I'm having this situation, how do I handle it? All the way up to, should I get a master's? Should I go for my doctorate? Should I just keep my bachelor's? Like all of those questions, having women of color to be able to reach back to, I think is really important. So I loved what you said, Ellie. I think that invisible work is just so key.
Okay, well,
thank you. Quickly, I'm going to read comments, and because again, the numbers are increasing when it comes to the questions, and if we're not able to cover them, we'll get the answers and forward them to you. I have Dennis Conway, who is the president of the Health Executive Club, and he says, what a great panel, most interesting presentations, and the round of applause to Verna, Marcia, oh, thank you, Dennis, and the 4 panelists. He says, thank you, and more thank you. We have Angelica Thomas. She says, big thanks to all the presenters. Continue making history. We have an anonymous attendee that says, thank you, Dr. Annette Tucker Osborne, by charging forward to pave the way for so many of us. We stand on top your shoulders as women of color in the forefront of military and veteran services. Today, I am with the diverse state and territory directors of Veteran Affairs, and we salute you. Oh, I got goosebumps.
Thank you.
We have also a comment from Michelle Edwards, and she said, I enjoy the diversity of each of the presentations. I learned so much helpful information. All the presentation presenters were excellent. And Dr. Ms. Thomas, Angelica Thomas, is also asking again if Dr. Beverley is the bridge, the team concept implemented throughout New York City Health and Hospital Network.
No, it's implemented and it's still operational. Remember, I said Queens Health Network is Elmhurst and Queens. At Elmhurst Hospital, the bridge team is still operational. And what they have added to the staff, they have added a pharmacist to the team. So in terms of the sickle cell support group is still operational, and the bridge team is still operational.
Beautifully. There goes your contribution. Loving it. And the last comment is from Yvette Williams, and she says, thank you for sharing. You're all motivational in your presentations. So thank you. So with that, we're running out of time. And so I will turn it back over to Verna FitzPatrick.
Well, I am just so delighted to have sat here and listened to all the great presentations from our panelists. It's unbelievable. Your experiences, what you have brought to your careers and to the fields that you're involved with, and how you're moving ahead, not only as an individual in your profession, but you're helping others to move forward. That's the only way to do it. One hand has to hold on to the next hand and pull each other up. That's the way. That's the only way. So I really wanted to wrap this up, and to, most of all, is to thank you. Thank each one of you. Dr. Elena FitzPatrick Sifford, Dr. Beverley, Ms. Lissa Southerland, Dr. Annette Tucker Osborne, for your wonderful presentations. I thank Marcia Thomas for carrying the conversation forward in all respects. Your work, your contributions in your field are examples of what commitment and perseverance looks like. We should join forces and help the next generation and help others to achieve. One of the things that some of you may know, if not all, that the Black Long-Term Care Executives has worked diligently over the time the organization has been around, and more recently in the last few years, to help the next generation. We're looking at those high school students that need the internships that you talk about, the mentorship that you talk about, the support that you talk about, and most of all, the encouragement, because without that, they cannot move ahead. We're looking to see that these students participate and become productive members of society. And hopefully, we're interested in them moving into healthcare, but all of the careers that you represent are valuable, significant, and worth their involvement and hopefully their career aspirations to move ahead. You have demonstrated that you are the best thing, as Toni Morrison said. You are your best thing. You are the ones that make what you do the best. You are the ones that know where you can go, and the support and the encouragement of family, friends, and your inner strength is what moves you forward. One of the things that we have to remember, and I know that each one of you know it, what are the 2 rules in your life? The number 1 rule, never quit. And number 2 rule, always remember number 1. By Duke Ellington. Don't forget, never quit. And every opportunity is a learning opportunity, even when the results are not what we're seeking. I hope that this message is loud and clear and that we can help others, because that's our commitment.
That's what it's all
each
about.
other. That's what it's about. Once again, I want to thank you, all the participants, all of the panelists, all of the supporting organizations, the Black Long-Term Care Executives, the Health Care Executives Club, and all of those of you who are there. I want you to keep looking out for us, because this is not the first or the last program that we're sponsoring, and we plan to continue to engage you and keep you informed. Thank you all, and we'll see you at our next event. Remember, Black history is American history. Good night.
Oh, before that, Verna, just remind the panelists that they can expect a gift.
Yes.
Yes, a fun gift, surprise. And so you will be getting it shortly in show of appreciation for, participating and doing it with such enthusiasm and positive vibe. So it'll be coming soon. It's a surprise, so I can't tell you.
You're not going to know until you see it.
Until you see it.
Until you see it. It's something very special. So look out for it. Thank you. And
thank you, ladies. Thank you very much. We appreciate it.
Thank you.
To all, good night.
Very much.
Nice meeting everyone.
Bye.